It's time for Branding Business, the only show that brings branding experts and corporate executives together to explore how branding your business can improve both your top-line growth and bottom-line performance. Brought to you by RiechesBaird. And now here's your host.
Welcome to Branding Business with RiechesBaird. I'm Ryan Rieches, and today's show focuses on rebranding, one of the nation's leading pediatric care organizations. Today's guest is Carol Keese, Vice President, Public Relations and Marketing, Children's National, based in Washington, D.C. For some background, RiechesBaird had the opportunity of working with Carol and the executive team at Children's National as they evaluated how this 135-year-old brand could grow and increase its relevance in the rapidly changing healthcare landscape. Carol, welcome to Branding Business.
Thank you, Ryan.
Well, to set the stage for our discussion, I thought we could have a kind of a sequential flow of dialogue, beginning with your strategic intent of why you were interested in engaging a rebranding strategy, and maybe you could begin by just sharing your thoughts around either the business challenges that you were trying to resolve through brand strategy, or why the timing was right to evaluate the organization's brand.
Well, the timing really was right for Children's. And Children's has been a legacy brand with strong love in the community, I would say, maybe a strong word, but a great deal of goodwill and history here in Washington in serving the nation's capital and serving the underserved and being kind of an early adopter of community-based health before it was kind of the population health thing to do. So we've been around, as you said, for well over a century and a half, really. It had become kind of this sort of sleepy legacy brand that people knew about, but were perhaps thinking about it as a old school, maybe even a bit of a safety net hospital instead of the leading research and academic driven institution that it really was. At the same time, of course, we're seeing tremendous changes in the healthcare landscape, and we've increasing competition. We had done some early analysis to do some gauging of our brand equity strength in the market, and could see that we really were decreasing in awareness to somewhat an alarming rate, partly because there's been no advertising in the market. So Kurt Newman is our CEO, and he came into his position about 2 years ago. It took about a year to put a leadership team in place. And when I came on board, we had an initial meeting and said, yes, indeed, we did feel that the brand needed to be out there. We needed to get in the market and do some advertising and tell our story. But before we did that, we really needed to take a step back as an organization and have a research-driven process to define that value proposition and to enable us to tell a strong story, an authentic story, a compelling story. And then that could inform our marketing and our media strategy, even our digital strategy and our corporate. And that's what we did. So it was a great opportunity. It was the right time for us, for our industry, and for our leadership to take that next step.
Certainly a lot of change going on in your industry as well as your organization. And as you mentioned, many of the times when we're hired is because the perceptions out there are lagging. The organization had moved beyond those past perceptions and actually had a lot more of a story to tell. So along with that, you guys were working on your future strategic plan, and which is the case in many of our clients, is that the process we go through, specifically the research, is helpful in either validating or providing new information to guide future strategic planning. You alluded to it a moment ago, but maybe you could speak a little bit of the benefit of that parallel process?
Absolutely. I think strategic planning and business planning obviously starts with data and analysis of the competitive landscape and seeks opportunities to create synergies, right, that line up with either unmet need in the market or untapped business opportunity. That's a very important process, and it really is, although we call it a strategic planning process, for many top-performing organizations, that's a mindset. It's a continual process, a continual conversation. So that's your business strategy. We felt by lining up brand positioning in a parallel process really helped inform our thinking by helping us define what others saw as believable, compelling, and unique. We deliberately put our referring physicians into that research process. We put even our payers into that process. So we didn't just have a friendly crowd. We had a really good 360 view of quantitative and qualitative data from people that we were also engaged with in our thinking around strategic alliances, partnerships, and business development. So I think the power really comes when you align these two things together, you've got your business plan, your business strategy on the one side, you have brand positioning on the other. When you bring them together, you have brand strategy. And I think that's really where you see a great deal of efficacy in delivering against a really strong value proposition consistently and with great deal of focus. Many organizations, you'll see business planning and strategic planning like over here somewhere. You see branding sort of in the marketing sphere over here. And unfortunately, when that happens, neither side benefits from a holistic view and a synthesized view of where market opportunity lies and where brand positioning really gives you your competitive stance to help articulate and deliver against that. So we were really delighted to have that data feed into strategic planning and our thinking going forward.
Well, very well summarized, and I couldn't agree more. And from the outside in, you guys did it right. And as you mentioned, some organizations separate the two and don't overlap, and that rarely works. So kudos to you and your organization. You mentioned the research process spoke to and reached out to a number of different audiences, which is the case in many clients. But in your particular case, the number of people that were important for us to talk to was pretty large. Obviously, children and their families, referring physicians, the medical community, insurance companies, payers, as you mentioned, the local community, donors, and then, of course, the internal organization. Often the question is asked, how do you balance the importance of each of these different audiences?
You do so, first of all, by including them. And to your point, you want to cast a wide net. You want to have a diverse perspective, and you want to get both the qualitative and the quantitative view that is both inclusive and then ultimately specific. So, for instance, we did qualitative sit-down one-on-ones with about 55 of our critical stakeholders, and we changed the mix as we went through 4 different research processes to add a different set of perspectives and a different voice that would allow us to capture what people were feeling in their own words were both believable about children's and also what they were looking for and valued in a service like ours, so that we weren't just testing for our own belief about our own organization, but we were also looking forward into the white space about what is not being provided in the market, or where are people looking for something that they don't see. So by combining many different perspectives and yes, doing very rigorous quantitative to get to what are the things that are most impactful and most motivating, what phrases and what ideas, I think the qualitative was equally important because it gave us a perspective from, in their own words, from many of these audiences that we would never have had. And I'll give you an example. We had seeded into the research this idea that our sole focus is children, right? Which seems very logical. When we tested that, we got very poor response against that idea. But people, when they were allowed to seed into our process and source into our process their own ideas, and again, we're talking about consumers who have never used us, patients who have used us, our own staff, referring physicians, of great diversity of subjects and groups, when they were able to participate in and source their ideas in that process, they came back with a very similar idea that children and children's medicine is not part of what we do, it's all we do. And we would not have said it that way. Our thinking was sole focus on kids, sole focus on children. But when we got back the resonance and the tremendous lift that idea in their words gave us and showed through the research, we are now using that phrase in our advertising and in our messaging in many ways. And so I think that the combination of audiences and the combination of qualitative and quantitative in this process gives tremendous insight vertically in different audiences, but also gives you a great handle on how people think and how people language around what they're looking for and what they see in an organization. It's so very important. It really all lives in language. So I credit this process with a lot of insight around that.
Well, great example of the qualitative and quantitative process working together. And you're absolutely right. What seems sometimes natural, the way that brands are described, seems a perfect complement to what you really live and what you believe and how you deliver your service. But yet to hear it from the audience's perspective is really very, very important so that it will be believable, defendable, and relevant and well received in the future. So as you mentioned, most research prepares or basically provides feedback on how a brand is perceived today. But as you spoke about, we have to prepare the brand for the future. And how do we then take that information and then apply it so that the brand can live into the future and resonate with the core audience? So maybe you can continue just to speak a little bit about how that research then really did inform the brand positioning and clarify the brand promise.
Sure. I will back up a step and just say that in our perspective, brand positioning is really the competitive stance that from which you can move, and that this only gets more important the more competitive or more volatile your field of play. So it was very important to us to have a framework and a core idea that was authentic to the brand, authentic to the organization, but also compelling and resonant in the market, that then could inform the creative development of advertising. It could inform media strategy. It could inform corporate, and it could inform even internal communications. So we really found that coming out of this research process, this core idea of standing for children was very flexible and could allow us to speak to multiple audiences with a great deal of both consistency and relevance, which is it's a great sweet spot to aim for. We serve a lot of different audiences, so we talk to legislators, we talk to parents, we talk to donors, our peer institutions, our fellow providers, and we, of course, we're talking to a lot of our patients. So we go all the way from the White House to the underserved children in the district. That's a pretty wide swath, right? So how do we have a construct and a language and a vocabulary that we come back to again and again, but without sounding like it's a cookie cutter and we're speaking the same line no matter who we're talking to? So this research gave us a great messaging framework and matrix where we could talk to the same core idea of the sense of being champions for children, but to do so with a great deal of relevance. And we're talking to a legislator, we might be talking about advocating for the issues that affect children nationally, advocating for policy changes, those kinds of things. When we're talking in Ward 7 and 8 in our city, we might be talking about championing for better and more preventive health for the underserved children and expanding community-based care. So when we're talking to a parent, a worried parent who might have a child with a troubling diagnosis, we're able to validate to that parent that we might be the place that he or she would want to bring that child because we have the expertise to understand what's right for children and what's right clinically right for children, what's right to do in the situation. So with the many organizations are speaking to many audiences, I think in medicine, particularly and probably in academics, we're talking to perhaps more even than a large organization. So having a rich validated platform to stand on that gives us the vocabulary again, and it gives us a consistent message, but also a very flexible one, really is tremendously important. I think consistency is sort of the currency of credibility, right? We always want to be consistent in our voice and our message, and that helps our CEO in his one-to-one conversations with the mayor, as much as it helps our organization speak through our website to consumers who are looking for care.
Well, very well said, and consistency of message is critical, and it really is important, both the internal audience as well as the external audiences. And on the line of consistency, maybe we can chat just a little bit about consistency of both your name, logo, as well as the brand architecture. So the name of the organization, Children's National Medical Center, your organization had moved beyond just a place, just beyond a core hospital, quite expansive organization and actual system. So throughout the process and through your strategic planning, the name Children's National Health System emerged as a much bigger idea, bigger than a place and a much bigger idea. And then we actually took it to the next level of what is the brand, and that is Children's National. then that flows down to the brand architecture or the nomenclature and naming as it relates to all the different organizations and entities as part of this more expansive system. Maybe you can chat just a little bit about the importance of getting your arms around this, because many organizations struggle as they grow, trying to bring in all these different extensions of the brand. So now often we're brought in to help bring some controls to a system. That continuity and consistency you mentioned is so critically important for the future. So maybe you can just chat a little bit about that and how you've implemented it at Children's National.
Sure. I think the movement from medical center to health system was such an easy one because, in large part, medical center was really a misnomer. So Children's National started as a community-based organization, really on a city block in a small townhouse. At that point, a townhouse building in 1870. So we started as that ambulatory, we now call ambulatory community-based care. We then evolved, of course, and added over time specialty services in acute care hospital, and now we have one of the nation's leading specialty hospitals for children, but we have always had our roots in the community. So when we moved to consider health system, it really was more of a homecoming than a shift in direction, and it was much more accurate in its description of who we have always been. We have, to this day, we have, yes, an acute care hospital, but we also have ambulatory specialty centers, and we've got primary care centers, and we have community outreach, and we have a whole network, and partnerships and joint ventures. And I think that you'd be hard-pressed to find a medical center today who really is a medical center and a physical hospital, and that's all. So it was really an aha moment, and just sort of felt like the shoe was just fitting suddenly so much better when we moved to health system. We did seed both health system and medical center into the research, and we did kind of a due diligence and testing out, well, how do people feel about these two words? And we were very surprised to see the strength that came through with health system. When they were on their own, neither one of them, did particularly well in the research, but when combined with other ideas, like standing for children, like children's medicine is not part of what we do, it's all we do. The health system idea was the number one triple concept. It was the number one performing basket of ideas, if you will, for our brand. And we think that's because it really is a proxy for the breadth and depth that we offer and for what people, again, are looking for, not just what they believe about us, but they seemed to really respond well to the idea of a, if you will, soup to nuts. It's primary care, it's wellness, it's preventive care, and if it's needed, it's also highly acclaimed expert care for acute conditions. We know children because that's all we do. So it was a great discovery for us, but it also felt like a homecoming.
Well summarized, and it's good to now provide clarity and continuity, not only in the naming, but also in the visual identity. So maybe we can transition a little bit to that as we take a look at how the corporate identity was evaluated. In other words, the face of the brand, what people typically see associated to a brand promise. So in your case, the organization's logo was, and still is, a bear, and that symbol had been used for many years. And when we first started working together, we asked the question, is it possible to update the bear's image and look and feel? And so some in the organization were resistant to it, and others were very accepting to it. So as we brought forth an evolved identity, paying tribute to the legacy in the past, yet bringing the bear and the image more current, which is often the case, we felt that it provided a much better visual representation of what the brand stands for. But maybe you can describe from the internal point of view how that was received and how it's been accepted so far.
Oh, it's been embraced. We had a couple of issues with our logo. One, it really felt dated in its overall look, and then the bear itself was probably less professionally designed than you certainly helped us create, and we would do today if we were starting it over again. And it wasn't as warm as we would have wanted. So we were really striving for both warmth, being a children's hospital, it's important, warmth and professionalism. So we wanted to project that strong yet approachable, child-friendly but nationally ranked organization. So we worked through a process to develop a refinement to our logo. It kept most of the equity in it, which I think is also very important. And good brands regularly go through refinement of their marks, keeping all of the equity that you have in color and shape and mascot in our case, but not deviating so much that people get confused about who you are or what your change is, but to keep it fresh. And I think that's what we were able to accomplish with this one. We updated our bear. We just pulled the design in more tightly. We gave it a very strong, current, almost timeless, I would say, type treatment that feels very modern now or very relevant now, but doesn't feel achingly modern. It's going to be very, would be looking odd 3 years from now. Just a great deal of strength in the mark. And the biggest thing we did was that we gave the bear eyes. Prior bear had kind of eye sockets. I'm not sure how to describe it, but it's sort of a blank. It's just sort of eye circles, but with no pupils in them. And people would jokingly refer to Dr. Bear as the zombie bear, but no one had really taken on the task of looking at this. And so this whole positioning gave us the opportunity to, yes, go through the research process, but then apply that to our look and feel, starting with our mark. And it has been so well received, and it's been so difficult now that we have the bear, the new bear, who is so fresh and light and warm and approachable now that he has sort of focused eyes and a smile, but also the strength of the whole lockup and the strength of the colors and the type treatment. It's been very hard to go back and look at the old one. Now when people see the old one, it's almost jarring because it doesn't feel like a fit anymore. We got spontaneous standing ovation, actually, when we debuted the bear to the management level of the organization. I wish I'd recorded it because you could hear this gasp go through the audience, and then everyone stood up and applauded. So, it's probably the best possible outcome in an organization. In our case, I think it was just overdue, and people were waiting for it. My CEO jokes that his legacy is giving the bear eyes, but it's a great legacy to have because that is how we're known in the world.
Well, you're absolutely right. The visual component of a brand is often a very emotional connection, and especially in your case. And it was a fun process to go through in terms of evaluating how much change should occur and how much we wanted to bring forth the personality of the bear, which reflected the personality of the brand. Yes, we did change it a fair amount, but yet retain that equity. The interesting thing, though, is, as you mentioned, people were very receptive to it, and I think some who you don't put it side by side might even not notice much of a change, but just it feels more current, feels better, it feels more right. Mm-hmm. So it was a fun process to go through. I'm so pleased to hear that it's been accepted so well. And so from the identity, then the process typically involves applying what we call brand expression, giving the image new life in terms of a color palette, typography, imagery, photography style, the templates, and so forth. And that, of course, as you mentioned, the importance of consistency will then help be able to provide the information for all kinds of messaging that is appropriate per individual audience. And the internal audience is, of course, one of the most critical audiences for any organization evolving their brand. Maybe you can speak a little bit about how the internal launch was orchestrated and how that continuity and consistency has been presented and received so far.
Sure. So I've touched a little bit about what our positioning is really founded on, the sense of being champions for children. And when we developed that positioning, and Kurt asked us to think about a family of words that could go alongside champion, that would be inclusive and allow us to speak to this sort of dimension of advocacy in many different ways. So we created a library, a family, if you will, of about a dozen or so words like protector, sponsor, advocate, steward, yes, champion, but also visionary, leader, defender. All of the words that would speak to that same sense of personal investment and going beyond for children and for the sake of the health and well-being of children. So we use those words to introduce the brand to employees, to our staff, putting them as the brand, not just the brand champions, but the brand itself. If you take the people out of this organization, all you have is the building. And I think that's particularly appropriate and relevant in healthcare, where human beings are our service, are our product, if you will, and as well as our those we serve. So I think it's a very intimate, it's a very human-based you will, business to be in. So for us, it was really all about showing employees, showing our staff, showing our colleagues that they themselves were, in fact, the brand. And we did that by introducing them to these words, by encouraging them to sort of pick a word and own it, tweet about it, talk about how they were that, or they found that they felt their team embodied that word or this other word. We constructed a very large graphic wall space in our second floor, which is where most of our staff come through. We actually highlighted 6 of our staff, sort of threw them up there almost like a wall of heroes with these words so people could really see bigger than life and how we every day live that commitment and are and those words and embody those ideas. And again, we had a little bit of a social media campaign going with it. It's very nice. We changed even the lanyards that we wear our badges around on our neck have these words around them. So we really didn't do a lot of big splashy things, but we focused instead on connecting people emotionally to their own reason for being here. And I think it was because we did it that way, it was really inside out first. It got a lot of very positive feedback.
Well done. I can say that many times when organizations are interested in rebranding, their sole focus is on the external market. The internal audience is unfortunately often overlooked, and I know you guys didn't do that, and you had that philosophy from the very beginning that you saw the brand as the people and the opportunity for the people to see themselves in the brand and have that emotional connection is such a critical component of launching any brand. And now you've launched the brand externally, advertising, PR, website. And we only have just a couple more minutes, but maybe you can talk a bit about this. It's only been a few months after the launch. How has the brand been received so far?
Externally?
Yes.
Very, very well. We saw this fall as really a reintroduction of Children's National to its own market, almost like a challenger brand. So we have been doing some fairly visible out there tactics. So we have, for instance, about 25% of the buses in the district in the surrounding area are covered with children. We have taken over fraction of Metro here in Washington. So we have a station domination, so we own one of the largest, the most busy metro stop here in the city. We have taken out 3/4 page ads in the Washington Post. These are not the kinds of things that we would do typically in an ongoing, more consumer-focused, more service line-focused ad campaign, and we will be shifting gears into a more, again, consumer-facing call to action, more of a service line focus in the second tranche of this campaign. But the first one this fall was really about reintroducing putting Children's National into the consideration set for people that maybe had discounted it as a sort of a sleepy legacy brand, and having people really reevaluate what they thought they knew about the organization and be open to hearing more and soften the ground, if you will, for additional marketing and advertising to follow. And it's been wonderful to hear the many reports of people providing great feedback. I had an interview yesterday with someone who had come through Metro Center, had not really known much about Children's, and then came up to our offices through Metro Center and says, "Wow, it's amazing what you all are doing." So those anecdotal things are great, but we're also looking at the data. So we are tracking closely to our call center to make sure that we are staffing appropriately, even with active marketing in the field. We want to make sure that we're not that we're maintaining a level of access and responsiveness that needs to be very nimble and responsive to that marketing. So we're seeing a 25% increase year over year for call volume for just the month of October, which isn't even complete. So I'd say the first 3 weeks, we're seeing about 700 calls that have self-identified as coming in through the advertising and in response to advertising. That, for me, is a high number, given that we have a very soft, a very high-level campaign right now called Action. So it's really about just reintroducing Children's. There's no specific call to action, and yet we're seeing, again, a 25% increase in call volume to our call center. So we'll continue to watch that to make sure that we're calibrating and we don't turn the spigot up so high that we can't deliver the service and the quality that we always want to. So it's a partnership with operations to watch, when is it too much, when is it, when do we need to provide extra services and support. But that's a great problem to have, I will say. So we're very pleased so far with this.
Great. So happy that the brand is being well received internally and externally. Well, Carol, we're almost out of time. Thank you for being a guest on Branding Business. Any final thoughts or insights to share with our listeners?
Oh, I wish that healthcare would avail itself of this kind of process more. I think there are a few kinds of industries that have a more important mandate and a more compelling story. I wish that I saw more of my colleagues, and I hope to see more of my colleagues do this kind of rigorous exercise to define a, again, compelling, believable, defensible, resonant message that can then inform the work that they do across many platforms. I think it's terribly important. Healthcare is not a parity product. It matters where you get your care. So I personally have an investment in seeing my industry take more of these approaches more often. And certainly look to this as a great case study of what can go right and what a great benefit is to the organization in the long term to invest in this kind of process.
Very well said. Carol, it's clear that your passion was bright throughout this entire process, and it's just so fantastic to see your passion in everything you do and the impact you've made with this organization. So thank you. If our listeners have any questions of you, how could they reach you? You have an email address that you could possibly share?
I do. It's Carol Keese, CarolKeese, at childrensnational.org, or ckeese, CKEESE, at childrensnational.org.
Thank you, Carol. And again, thank you for being a guest on the show. This is Ryan Rieches, and you've been listening to another edition of Branding Business with RiechesBaird. If you'd like to listen to past shows or read our blog series, visit brandingbusiness.com. Please share your comments, as we can all benefit from the discussion and varying viewpoints. Until our next show, thanks for listening, and stay focused on your brand promise.
You've been listening to Branding Business, the only show that brings branding experts and corporate executives together to explore how branding your business can improve both your top-line growth and bottom-line performance. To hear more, simply visit our website, brandingbusiness.com, or tune in next week to learn how you too can build your brand and move your business forward. Brought to you by RiechesBaird.